The Methodist Hospital Patient and Family Partnership Council is made up of volunteers who have had hip or knee replacements. The Council's mission is to improve patient experience and surgical outcomes through partnership between patients and the orthopedic department, as well as providing peer education and support for patients and families going through the joint replacement process. The Council sponsors Patient Perspective Sessions, an opportunity for patients preparing for hip or knee replacement to meet with volunteers who have been through the process and will share their experiences and learnings. Here's a brief sample.
My name is Gwen, and I had a right knee replacement 6 months ago.
My name is Pat. I've had both my hips operated on.
Hi, I'm Jim, and I have had 2 knee replacements.
My name is Barry. I had bilateral knee replacement surgery.
My name is Claire, and I had a double hip replacement.
Well, back in October of 2016, I was walking and I twisted my leg, my knee, and that set off a lot of knee pain. Initially, primary physician recommended physical therapy. I did that. Then I went to see an orthopedist, and basically he looked at my knee, looked at the x-rays, and said I would recommend conservative treatment first. And so I started out with more physical therapy, some cortisone injections, and after about 2.5 years, the cortisone injections no longer worked. My knee was getting worse, had a real significant flare-up, and we talked surgery.
It took me a number of years of suffering and trying to convince myself that I did not need hip surgery. And finally, my doctor was wise, and I listened to my family, and I decided it's time to do it. There's so much I missed in life by not taking the initiative to have that surgery and to get it over and to get my life back together and do the things I enjoy and would be with my family again. So I would just suggest sooner is better.
I was very fortunate to have 2 very successful operations, and I'm very happy that I have done them, and my quality of life is much improved. I had been having a lot of trouble with my left knee. This was the first one. And I could walk, I could do things, but I had to take a couple of a leave and put a brace on. And I was having cortisone shots. The cortisone was diminishing in what I was able to do. Talking with my family doctor, he suggested that I just talk to a surgeon and find out what my options were. And once the surgeon said, we can do all these other treatments, but there's one thing that none of them can do. And I said, what's that? And he said, we can't fix the problem. The only thing that's going to fix the problem is to have a knee replacement. And right at that moment, I said, okay, let's do it.
I decided to have surgery because I was losing control of my life. I was not able to play with my grandkids the way I wanted. I wasn't able to play golf the way that I wanted. And most importantly, I wasn't able to keep up with my wife on our daily walks. It was a sign that I needed to do something more to change the trajectory of my health.
I did not have a big choice. I was practically bedridden, and so this was a necessity to survive and enjoy life. It went well, and I had the second one 3 months later. And I have been extremely satisfied ever since.
I went to transitional care, and I'm very glad I had an opportunity to do that. So I had help with pain management from a professional staff, and yeah, it went very well.
Before surgery, I was a little bit concerned about the procedure. I was also concerned about the outcome. But after visiting with the folks here at the hospital, going through the brochure and talking with everybody involved, including my surgeon, I became confident that the outcome, if I did my part, would be good.
There's a process the hospital has, and if you follow it, and that process is really, in the book they have, it's a little 3-ring binder book. If you read it and you do what it says, and you have a right attitude and approach to the operation and to the process, and you do what's in the book, life is a lot easier.
I think I was better prepared for the second one, having done the first one. For the first one, I did a lot of walking, and I live in a hilly area, so I would take long walks in and out of the hills, and that helped get my leg ready for surgery. The second time I went to a club, and in addition to walking, I was doing leg weight lifting and riding a stationary bike, and it paid off. I mean, I walked out of the hospital the first time. The second time I also walked out, and I was able to pretty much take on a somewhat normal routine by the time I got home. So that the level of preparation ahead of time was just critical to a quick turnaround on the recovery.
Attitude is really important, because if you don't come in with the right attitude, if you come in with a chip or some other degree or thought process or whatever it might be, if your attitude's not right, you're not going to take control of yourself in the healing process. You're not going to take advantage of all the things that goes on the hospital has to offer. Your attitude, like anything, it's a mind game. You got to go in with a winning attitude, and you'll come out with it, and it's a must.
Advice I would have for decision making and having hip surgery would be not to wait. Go ahead and have it as soon as you're ready to have it.
Think in terms of weeks and not days. I had kept a diary, and I color-coded the days. Red was a bad day, green was a good day, and black was just normal. And the first week I had more red than I had green. The worst days I had were generally followed by a very good day, and it usually marked some progress happening. Always keep the attitude positive. Just because you will have bad days, but they're going to be followed by good days. And if you look at it in terms of weeks, it will get better and you will get back to normal.
Do your exercises, do your exercises, do your exercises. I can't stress that enough.
I'm Claire. I am a patient perspective volunteer.
My name is Gwen.
I'm Pat.
I'm Jim.
I'm Barry, and I'm a patient perspectives volunteer.
And I'm a patient perspective volunteer.
And I'm a patient perspectives volunteer.
If you'd like to attend a patient perspective session, contact your surgeon's office for dates and times.